Greetings. My name is Dr. Jeanette DeWitt. I'm a doctor of physical therapy, a certified athletic trainer, a certified personal trainer, and a certified precision neuromuscular therapist. I'm also a fitness nutrition specialist and a corrective exercise specialist, as well as I am credentialed in exercise is medicine. I specialize in working with people with aches and pains, stress and strains, and more specifically, who are experiencing headaches, migraines, jaw pain, and neck pain. I like to say that I help people experience headache-free days. So what I have here is the Renpho trigger point or deep tissue massage gun. This is an excellent tool, whether it's this brand or whether it's another type of massage gun that you might have already. This is a great tool to use in between medical massage appointments, as well as part of a corrective exercise program. If your muscles are super tight and they're just tense, it is not possible for you to get really good muscle activation for muscle contractions with strengthening. And it's also not possible to really get a good stretch and have a great flexibility experience when you are stretching. The reason for that is if you have muscles that are supposed to be normal tension like this, but they're all knotted up like that, you can't do proper work. The muscle's already in a shortened position. So what happens is it doesn't really have a lot of a place to go to shorten more to do work or to contract and get stronger. If you're trying to gain flexibility and you have these muscle knots there, it's not possible to stretch out because you have restrictions in the tissue. So in between medical massage appointments, you can use a soft tissue and a deep tissue massager like this to help get those restrictions out of the soft tissue. Now, it does not replace a massage therapist or a medical massage specialist like myself. I specifically do precision neuromuscular therapy, but it can help to complement the treatments that they're doing or like I'm doing. And you can maybe schedule less appointments because you're able to provide some self-care at home, which is a great savings to you. So what I look for in a massage gun is something where you can rotate the angle of how this is going to affect the leverage and your ability to reach the target tissue. Now I'm going to turn this on. It's going to make some noise, so I won't keep it on very long. But what I want you to hear is that it is going to have 4 different levels to it. So you also want to have a tool like that that is going to allow you to have a low level. In this case, it's 25%, and then it goes up to 100%. So if I were to turn this on, that is at 25%. And then that goes up to 50%, 75%, and then 100%. And basically that vibration, the levels of 25, 50, 75, and 100% are how fast the tool is vibrating. If you are experiencing muscle knots, like a lot of people hold their tension here, there's 3 muscles that tend to be the headache muscles. They kind of create this question mark experience for the person who is suffering with a migraine. And it's this muscle here that kind of pops out. That is the sternocleidomastoid muscle. I don't recommend using this on that because it's very close to the carotid artery. It's also in a very sensitive area in the front of your neck. So I don't recommend using this on that. But the upper trapezius muscle from here, and then the levator scapulae muscle from the vertebrae in your neck on the 1, 2, 3, and 4 level, all the way to the shoulder blade, top portion of it here. Those 3 muscles, sternocleidomastoid, upper trapezius, and levator scapulae, are chronic muscles that like to hold tension. And applying this to the upper trapezius and the levator scapulae muscles is super helpful in reducing tension. So this is how you would do that. I'm going to just have it at 25%. So you can hear it, and my voice will vibrate a little bit. But see, I've got a muscle spasm or a muscle knot trigger point there. So it sounds different. And it feels different when I'm pressing too. So you can see how that works. And then you can switch. We can compare it to the other side. See, that one is, there's more of a knot because it's causing, I've got some tension. It's causing the massager to actually bounce a little bit. That's how tight that tissue is. And that is not uncommon. So I'm kind of glad I have some tension there, because then you can see it's especially tense there. Like that's a little bit sore. I would not want to increase this more than 25%. So you can see and hear the sound difference. There's a different quality of the sound depending on the tightness of the tissue. When I was out here, it sounded a lot different than when I was back here. The other common thing that people want to know about with the deep tissue massager is which head should they use. I personally like the flat head. It provides an even surface area, and it really works on pretty much all soft tissue. However, there are options that you can use. I also like this head because when I do this, this works really well along the spine and these small little muscles. And it's okay to do that and have somebody help you go all the way down along the spine. So this works great for that. It also works really well for like the Achilles tendon area, because then it's not going directly on the Achilles tendon, but it's going on the sides. So that one works well there. And then we have two trigger point ones. This one is for something that's bigger. So soft tissue, like your gluteus muscles, your quadriceps muscles, your big muscle groups. This one works okay for the neck area and for the shoulder, or even the upper arm if you have some biceps tightness. This works really well for tennis elbow as well, and for golfer's elbow. So those muscle bellies. And then in the calf muscles, you could really choose depending on how large your calf muscles are, because some athletes have very big calf muscles. You could choose either option. I also get the question about these round ones. I personally do not use these very much because they're rounded and they kind of, I like the flat head because I know I'm getting all the surface area. Also in my office, when I use the massage gun with people, I can't wipe these off. They don't allow me to have proper sanitation. So what I do use them for is I have used them with a towel over a person, and I'll use them on the gluteal muscles or the low back, but the flat head just works better for me. And when I talk about the flat head, it's the one that's in here already. Now, personally, I have used this on my glutes, the larger one for like my glutes and my quads and my hamstrings, and then the smaller one for my back area, shoulder area, my upper arms or my calves. But again, the flat head works just as well. And I feel like I'm just getting a cleaner surface tension area. So those are the options and the different attachments with this. And the purpose of this is to help decrease trigger points, decrease soft tissue restrictions, restore blood flow and circulation to the muscles so they can properly heal. And if you're experiencing a lot of stress and tension, it works great on a daily basis for 5 to 10 minutes in those problematic areas before you work out. You want to reduce tension and tightness and muscle restrictions or soft tissue restrictions before you exercise, so that your muscles have a good warm up and they're not restricted going into your workout. I hope this helps, gives you a little bit of insight into how to use this and why to use this. Thanks a lot, and I hope you have a great day.